My pleasure to be able to address you again this morning and give you an update on how things are going at the university and what we're looking at for our future as we slowly get through the COVID-19 crisis. I wanted to start with the topic that's probably generated the most concern and the most emails more recently, and that is, what are we going to do regarding coming back to work? I'll let you know that we are continuing to follow this very closely. We are going to abide by Governor DeWine's recommendations set forth by him and Dr. Amy Acton in the Ohio Department of Health. Currently, they're looking at a phased back program beginning May 1st. Now, May 1st is a Friday, so my intent would be, as we begin to follow what is being accomplished at the state level, that we would not make any moves at Northeast Ohio Medical University until that Monday, May 4th. So May 4th would be the earliest that we would start to resume some type of activities. And again, that's going to depend completely on what we see take place over the course of the next 2 weeks. Other states, other cities are the experiments that we're looking at as we watch many of them start to wind down their shelter-in-place orders. Ohio will be a little bit slower than some, and we'll be able to watch what takes place in those geographic locations. Have they seen an increase in a new peak of viral cases? Has there been an increase in mortality rates, increase in hospitals getting close to exceeding capacity? And if that were all to occur, then almost certainly we would delay this plan. At NeoMed, we are working with the Inter-University Council, which is putting together a team that will be looking at how the universities will respond specifically to our approach to coming back in a phased methodology that will be potentially more conservative than the one that's being put out by the governor's office, just to ensure the safety of our populations and our community, noting that what we do is somewhat different than the way the majority of the other companies that would fall under this would operate. For instance, having students congregating together in large lecture halls is certainly going to be riskier than it would be for employees to be at assembly lines or for employees to work in offices. So we have to take those special circumstances that we have in a university into context. And with that, we've already made the decision that we will not return to classroom-based, at least large classroom-based education until at the very earliest, the beginning of the fall semester. That said, we will be evaluating what we're going to do with our fourth and third year students in the College of Pharmacy and the College of Medicine, who traditionally in these years are put into the clinical setting. That is where they get their education. It's a critical component of how they learn to take care of patients so that they can be really talented, well-informed, and outstanding physicians and pharmacists for our communities as they graduate. This will be a more difficult decision for us. We know that in the hospital setting, there is a greater risk of exposure to the student and also to the patients if some of our students happen to be carriers of COVID-19. And currently we still have a low number of PPE, critical aspects of PPE donning that will allow them to be safer that are not currently available at a rate that they should be. So we would not do this until we were absolutely certain that appropriate personal protective equipment and protective measures were in place to protect both our patients and to protect our students. As I've mentioned before, this is an area that's generated a lot of conversation with our students, both wanting to get rapidly back into the clinical setting, as well as those who have very legitimate concerns for getting back into the clinical setting for their own exposure, as well as that of loved ones who may be at high risk that they are currently residing with. For our own faculty and staff, we sent out a survey. That survey was to get an idea of how many of our community members currently are either at high risk themselves or live with people in high risk groups. We've had 364 respondents to date. Of those, about 30%, or roughly 35 actually percent of our faculty member note that they are either at high risk or live with somebody at high risk, and approximately 40% of our staff members reported the same issue. We do understand the anxiety that can be created by returning to work either too soon or just returning to work at all, given the fact that our lives have been upturned with something that we are just barely learning to understand and learning to cope with, and understanding how to remain safe. For those individuals who are at high risk or live with individuals who are at high risk, as we start to approach our phased in return sometime in early May, then we will certainly take into account your needs and continue the ability to work virtually for many of our team members at a greater length of time, to ensure that it's absolutely safe for them to come back when we finally do return them back to the workplace. Your safety, your health, and that of your loved ones in our community as a whole are really the number one drivers for us developing a very safe and phased-in plan to be able to do this. This may require a need for our community members on campus to wear personal protective equipment. We will at the very least follow the measures that are required by the Ohio Department of Health, which will certainly include continued social distancing while at work, making accommodations for that to happen and keeping people spread out, as well as the utilization of face masks while interacting with other individuals. We will very likely be able to bring additional PPE in that's above and beyond those that have been requested by the Department of Health for Ohio, and to be able to make that available for those who choose to do so. But that will be something that we'll work on now and have been working on, to be able to have a plan in place when we finally do phase our team back into the workplace. We've also been working very closely with our clinical partners, as I mentioned, regarding our students but getting back into the clinical setting. This is not just our decision. This is a decision of the group as a whole. When the health systems feel it's safe for students to return, from the aspect of student safety and patient safety, and when we feel it's safe for our students to return. Currently, we have students not returning to the clinical environment until at least June 1st. This may be extended substantially, and we will be following the national guidelines being set by our accrediting bodies to help us figure out what the best approach to this will be. I do want to step away from the downsides of operating plans that are constantly evolving around COVID-19 and how we're going to do things differently and how we'll hopefully get back to normal, to really congratulate the students in our College of Pharmacy who had an outstanding match day this year. Really, their match results were tremendous, and they have outshone those in other universities in Ohio, and also greatly exceeded those of other universities on average across the country. So my congratulations to Dr. Kasmer and his team, and my congratulations to the students for an outstanding match that we'll be celebrating with you later this week. Many of you may have heard that we've also decided to create a new homecoming week to celebrate our return to the university, hopefully a return to normalcy, and to recognize our current graduates, our alumni, our faculty, and our staff for all the incredible work that they've endured during this unique period of time during COVID-19. We're currently planning for a celebration on our campus July 23rd through 25th. We do recognize that we don't fully understand how to forecast what the conditions will be, and there may be a need to postpone this. We're hoping not. But we are planning for it to occur, and we are also making plans for alternate dates if absolutely necessary to do so. Commencement is moving forward as planned. As I noted last week, the university has been recognized nationally as one of 4 that have done something incredibly special to be able to recognize and celebrate our graduates at a time when most universities are either canceling or significantly postponing their commencement days. Our team led by led by Sandra and Rod Ingram have been able to put together an outstanding plan. We've hired a professional production company to come in, and they have pieced together a really, I think, a really spectacular program. So this will be a combination of pre-recorded as well as live event that will allow our students to celebrate with their families in regalia and have moments for individual recognition that can be shared virtually online through a Zoom type forum. So thank you for everybody who's helped make this possible. We are also really pleased to announce that the new center at Neomed has stepped up utilizing its food catering services and is now delivering on that promise that we had made to deliver outstanding food to those in need and to those individuals who are serving on EMS in the front lines in the hospitals. That started last week and has gone flawlessly, and we've received a great deal of gratitude from our local community for being able to provide that. So a big thank you to Andy Mounts and his team for being able to pull that off, and to all of those, including our own foundation, who've helped fund the ability to provide these meals for those in need. I also really thrilled to be able to share that our students, our fourth-year students in the College of Medicine, came together and created a contingency plan for surge care. It's a 51-page document that outlines how we will provide a 200 to 800 bed facility to decant our hospitals in the event of a COVID-19 surge. It was an incredibly educational experience for them, and they were able to work with the Ohio National Guard, the Army Corps of Engineers, Kent State University, our own university, and a group representing 13 health systems within the region of Northeast Ohio. Outstanding plan. Fortunately, it looks like we're not going to have to use it, but what they put together was so comprehensive, we're going to be able to use this for the future as we are almost certainly going to be faced with another pandemic again. And rather than having to be greatly delayed in how we implement the ability to take care of our community, the outstanding work of these students, led by Dr. Cyril Harfouche, has allowed us to put something on pen to paper that can be utilized now and also for our posterity as we move forward. So a big congratulations and thank you to them. While we're on the topic of our fourth-year students, both in the College of Pharmacy and the College of Medicine and the College of Graduate Studies, I want to recognize these outstanding individuals who are finally finishing up a very long and fruitful course of study. We have, including today, 5 days left in the normal academic calendar for them. They will have completed their studies, and on May 2nd, we'll be able to recognize their amazing work, their achievements, and get them off to where they can practice in their chosen specialties across this country, with especially here in Ohio, with over 53% electing to stay in Ohio and take care of our Ohio community. So a big congratulations to you once again. We are currently waiting on the governor's budget plans. As I shared before, the governor has publicized that he is asking all state entities to have a plan to reduce spending by up to 20%. We don't know what that final number is going to be, but we've been asked to be prepared for a 20% reduction in overall state funding. And for every public university, this becomes a substantial amount of the financial resources they use to run their organizations. Besides that 20% cut, up to 20% cut, we're also expecting that many universities will see a dramatic decrease in enrollments, which is the other portion of funding that most universities rely on, and that is tuition and fees around taking care of students at their universities. This will impact many of them also on their inability to fill their dormitories, food services, and other resources normally in place and paid for at a university to take care of these large numbers of students. I bring this up because many of you are going to be hearing statewide what other universities are doing, and we're expecting to hear from them likely by early May at the latest. This could include plans for substantial furloughs and substantial layoffs. We just need to wait from the governor to be able to determine what those decisions are going to be. We're hoping that things will be improving rapidly under the governor's return to work plan, and we will not have to make these tough decisions. I'll tell you, we've had these discussions at the NeoMed emergency management team level, and we are asking our department chairs and our deans to come forward with their budgets for next year to include operating as normal, as well as budgets that would also potentially have a 10 or 20% reduction in total costs to be able to run their programs. I feel confident that at NeoMed, we'll be able to really have a limited impact on any reductions on how we operate as a team. My goal is to ensure that everybody stays actively employed and great members of our NeoMed team delivering outstanding research, education, and service to our community. We may have to make some tough cuts around non-critical programs, but I'm hoping that doing so, given the fact that we've been able to manage our resources so well under the guidance of our Board of Trustees and the leadership here at the university, that the impact will be substantially less than it will be at other universities. We're also really fortunate that we have a graduate university focused mostly on professional development. We do not expect to see a substantial decrease in our enrollment or decrease in the tuition dollars to support the activities of educating our students. And so most of the impact we will have will be related to the reduction in dollars by the state. We stand ready to support our team of faculty, our staff, and our students, and to make sure that all of you are taken care of and gainfully employed to the best of our abilities. I also want to recognize some great work that's been continuing in the background while we've changed the way we operate, recognizing Dr. Steve Schmidt and Elliot Reed for continuing to offer opportunities in the Ready Zone, which is our innovation and entrepreneurship program at the university. They are once again offering the Ready Zone innovation grants to our faculty and have noted that they've received 8 applications already, despite some of the unusual circumstances around the application, this process presented to us by the viral crisis. So a big congratulations to them. And finally, to our students, many of you know that the federal government has been stepping up to try and reduce the impact that this crisis has had on you. We recognize that many of you have been impacted by the financial downturn. You've also got obligations that you intended when things were running normally. And now that the overall financial burden has really put many people in a difficult position, we recognize you may have a hard time meeting some of those obligations. So the federal government CARES program is delivering about $120,000 to NeoMed that must be distributed to our students. And it must be based on need for those individuals who can show they've been impacted specifically due to COVID-19. The dollars have not arrived yet, but we expect them very soon. And our team, led by our VP of Operations, Mary Taylor, will be getting information out to you very shortly on where those dollars can be utilized to the benefits of our students and how you can go about applying for that money on a first-come, first-served basis until those dollars have diminished. In the meantime, our development team, through our advancement office under Daniel Blaine, is continuing to work very closely with our foundation board to raise additional dollars to support those of our students who've been greatly impacted by COVID-19 by creating a special fund to help offset some of these burdens for you, and at the same time be able to help pay for additional PPE for our students that will be returning to the clinical setting if and when that happens. So a big thank you to our foundation board for that. With that, I'm going to stop and open it up to questions from our community.
If there's a second peak with COVID-19, what will NeoMed's plan be for students and staff?
If there's a second peak with COVID-19, we're going to work very closely with the governor's office and the other universities to respond very similarly to how we've done now. Most of America, as we've watched on the news, have become somewhat impatient, or many in America have become very impatient with the shelter in place as they've watched the curve drop. This is a concern we had from the beginning, that if you were really successful at dropping the curve because of the measures we put into place, many will start to see this not as something we've been able to impact, but as something that wasn't really as big a concern as we thought from the beginning, and they start to see the measures we put in place as overkill. We knew this was going to be the case. So we're going to watch very closely, and we may find ourselves right back to where we are now. My hope is that we will not do that. We're going to watch these other cities and these other universities unfurl in front of us, and we will learn from their examples, as many are moving forward more rapidly than we are in the state of Ohio. And I think that's a good thing for Ohio. What our leadership in this state has done is taken care of the people of this state. As I mentioned before, we are a benchmark in how to do this. So we were one of the first to move forward and to move forward effectively. And it's okay to be a little bit slower than some of the others who are really trying to jump forward at a rate that some criticize as being too quick. We'll watch what happens with them, and that will help to steer what it is we do as a state.
When you say on-campus classes resume for the fall, do you mean fall semester 16 week or the header starting in July?
I'm talking about fall semester starting really in late July when we start to bring our students back. But again, that will be really dependent upon where we are as a state and where we are as a region. If we are still practicing social distancing, requiring 6 feet between individuals, still having congregation rules, not allowing more than a specific number of individuals to be in a room together, clearly we are not going to move forward with that. We'll continue to adapt through our virtual education programs. Virtual education has been working well for us. We know it's not ideal. We know it's not quite as effective as being there in person, especially for our starting first years who need to come together and need to be able to understand how education works at our university, what resources available, and benefiting from the bonding and the support of their fellow classmates in our faculty. But we're going to make do in a way that keeps them safe, and we'll just follow this as the timeline continues to, as I mentioned, unfurl and we start to understand what we can do safely.
For those of us who are able to work remote, what is the purpose of return to work in May via a phased approach if we still need the social distance? Wouldn't we still end up Zooming from our desks for meetings where we were in large groups and or small office spaces?
Yes, that's also something that we recognize. And what we're going to do is those who have positions that clearly work really well from virtual desktops, Zoom capabilities, we will make those the very last to be phased in. It's going to be more our essential workers. For instance, we have many faculty members whose research work in the laboratory is critical for them, for their career progression, from their ability to compete effectively for federal grants, and their team of individuals who help them in work in the laboratory conducting experimentation. For those, we understand the burden that this has placed on them. We balance it with the need to maintain their health and safety, but some of those will be the areas we start to bring back first, recognizing that those team members who are at risk or live with people at risk have to be given the option to come back as one of the later phases. And so this is just something that we're looking at, how to balance appropriately, and we will not bring people back in at a time where it's simply to have them on campus if we're not getting the necessary work benefit early on.
Should managers consider more flexible work arrangements given the success that we've had operating remotely?
I think flexible work arrangements are important for a number of reasons, and that's outside of just COVID-19. We have been implementing programs through HR. Mr. Andre Burton who came in and advocated very strongly for our faculty and staff. And with that, we've put in measures already that allow a more variable workday that's been tested with our staff members, although that testing was implemented just before this occurred. But that's, for instance, allowing some to come in a little bit earlier and take an extended lunch and stay later. We've explored a number of options. We think this is important just for work-life balance in general. And it's, of course, aimed at those positions that are not required to absolutely be on campus during specific hours to service students, because, of course, many of our service enterprises are absolutely critical and do need to run 5 days a week. In those circumstances where there is overlap, we still can do this with an assurance that our team is working together to provide coverage while still leaving that benefit to our staff to be able to have a little bit more time to work outside of very stringent hours. So I'm a big fan of that. I think it's critical, not just during COVID-19, but in general for taking care of our staff members and ensuring a very strong work-life balance.
For the decrease and reductions being asked by the Ohio governor, will you ask for another voluntary separation program like we had in 2019?
I don't know that we're going to do that. I have to really take a look at what the impact could be. My understanding from Dr. Gershon and also from John Ray, who used to be our vice president for finance and operations, was that the early retirement program turned out to be a somewhat of a mistake. What we did is we lost a huge amount of corporate knowledge, especially in areas like finance. And when those individuals left, it left a pretty significant reduction in our capabilities that we've now been able to overcome through hiring processes. But it really had a pretty big impact on the university. And so if that type of program isn't implemented very, very thoughtfully and very, very carefully, we can end up with unintended consequences that put us in a worse position than we were before. So currently, I'm not looking at that. What I'm hoping to do is to be able to decrease overall volume intelligently through attrition for individuals who want to leave or feel it's time for them to retire, and at the same time be able to reduce non-critical programs and non-critical areas of spending that allow us to ensure that we keep people gainfully employed here at the university.
There are no more questions.
Well, thank you to everybody in our community, our team, and our extended team here in Northeast Ohio. I thank you for your patience, and I want to thank all of you for all the hard work and effort that you put in learning to do things so differently, but keeping us a very strong and viable enterprise as a university. And one last time, congratulations to our graduating students who will be finishing up their final class weeks on Friday. Have a great day.